Hi, this is Dr. Bhargava. In this short video, I have a few interesting cases to share with you. Our first patient presented with this bone scan. The reason for the scan was prostate cancer, and we find that the right hemipelvis is showing intense uptake and it shows bone expansion suggestive of Paget's disease. There was a follow-up scan performed. This was a PSMA PET-CT in this patient. Let's start by looking at the rotating image from their PSMA PET-CT. We find that they have extensive disease, and so they have uptake in retroperitoneal para-aortic lymphadenopathy, right pelvic lymphadenopathy, and this large prostate cancer, which is their primary tumor in the prostate. So the interesting finding is that here on the rotating image, we see mild heterogeneous uptake in the left hemipelvis, where we saw intense uptake on the whole body bone scan. So this has been reported multiple times in several case reports, such as these, that there can be increased uptake, mild and heterogeneous, in Paget's disease on a PSMA PET-CT. This is our next patient. They presented with cognitive decline, and we performed a FDG PET scan of the brain. Here's the rotating image. The diagnosis here is frontotemporal dementia, because on the axial images at the superior level of the brain, we find that there is hypometabolism involving the frontal lobes. The parietal lobes are showing normal uptake, and more inferiorly, there is hypometabolism at the level of the subcortical nuclei involving the temporal lobes, and the subcortical nuclei are normal and intense. More inferiorly, we find temporal hypometabolism and preserved uptake in the visual cortex, which is also seen right here. And so the patient has moderate hypometabolism involving bilateral frontal and temporal lobes, with preserved activity seen in the parietal lobes, and this is consistent with frontotemporal dementia. This is a good article where authors say that visual interpretation of FDG PET after brief training is more reliable and accurate in distinguishing frontotemporal dementia from Alzheimer's disease than clinical methods alone. FDG PET adds important information that appropriately increases diagnostic confidence even among experienced dementia specialists. Here is our next patient. They presented for a FDG PET-CT scan. Let's start by looking at the rotating image, and we find that they have extensive disease. We have innumerable scattered foci of increased uptake involving not just the axial skeleton, but also the appendicular skeleton. And on the axial, some images I'm showing you lytic lesions right there in the left sacrum with focal hypermetabolism, in the left ischium with focal hypermetabolism, and again in the right scapula with focal hypermetabolism. And so this patient has a diagnosis of multiple myeloma, and we see FDG avid multiple myeloma with innumerable foci in axial and appendicular skeleton corresponding to lytic lesions in these places. So very aggressive and severe disease. This is an article on the topic. They discuss the use of FDG PET in initial diagnosis, staging, prognostication, and assessing treatment response in patients with multiple myeloma. Thank you for watching.